po natin for today is all about Philippine healthcare delivery system. So kung nakaraan po, pinag-usapan natin yung healthcare system. Ngayon naman po pag-usapan natin yung Philippine healthcare delivery system. Okay? So we have here we have here the healthcare system. Okay? First, pag sinabi po natin healthcare system, this is an organized plan of health services. Meaning, okay, this is nakaplano na po. So, naka-organize na. Okay, all about health services. Another one here is we also have here the healthcare delivery. So, when say healthcare delivery, it's all about rendering healthcare services to the people. Ibig sabihin po, as a medical professional or sa medical technology, nagbibigay po tayo ng serbisyo sa population or doon sa people. Okay? And then another one here is we also have here the healthcare delivery system. Pag sinabi naman po nating healthcare delivery system, this is the network of health facility. When you say health facility, ito po yung ating mga hospital. And then sabi pa dito, personnel, tayo po yan, medical professional, kung saan we carry out the task of rendering healthcare to the people. So, nagbibigay po tayo ng medical attention, okay, sa population. So, that is the healthcare delivery system. So, wag po malilito dito sa tatlo na to ha. Yan yung kanilang pagkakaiba-iba. When say healthcare system, organized plan. When say healthcare delivery naman, you are rendering services. So, tatandaan yung word na services pag healthcare delivery. And then, healthcare delivery system, pag may system po, that is a network of health facility, personnel, and also you are providing services as well. Okay? So, dito yung pinaka-kompleto, healthcare delivery system. Okay? Another one is we also have here the Philippine healthcare delivery system. So, Philippine. So, ganun din po, it is a complex set of organization kung saan interacting to provide an array of health services. Okay? So, now, pag-usapan po natin yung history ng Department of Health. Okay? So, history ng Department of Health. Number one is the pre-Spanish and Spanish period. So, noong bago daw po mag-1898, ang ginagamit pa ng mga tao is sa traditional healthcare. Okay, so when say traditional healthcare, herbs and rituals pa po, mga medicinal plan, di ba? More on pa yan po. Noon, okay, mga plan, yan, medicinal plan, herbs and rituals. As well as dispensary of indigent patients of Manila. Okay, dito rin po nagkaroon ng Medicus Titularis and also Superior Board of Health and Charity noong 1880. Okay, so ayan pa po. That was before 1898. Next, noong June 23, 1898 naman po, under sa administrasyon ni President Emilio Aguinaldo, ayan, nagkaroon na po dito ng department. But before po magkakasama pa yung Public Works, Education, and Hygiene. When we say hygiene po, that is health. Okay? So magkakasama pa po itong tatlo before. Public Works, Education, and Hygiene. Kailan po yan? Noong June 23, 1898. And then, noong September 29, 1898 naman po, nagkaroon ng General Order number 15 kung saan na-establish po nila yung Board of Health for the City of Manila. Okay? City of Manila. Next. Noong July 1, 1901, okay, nagkaroon ng Act number 157 kung saan nagkaroon naman po ng Board of Health of Philippine Islands. Diba kanina, City of Manila lang. Ngayon naman po, noong 1901, naging Board of Health na siya of Philippine Islands. Ibig sabihin, buong Pilipinas na po. Okay? Hawak na yung provincial and also yung municipal board. Okay? Then, noong October 26, 1905, nagkaroon po ng Act number 1407 kung saan na-establish po yung Bureau of Health. So, na-separate na po. Ginawa ng Bureau of Health. Diba kanina magkakasama silang tatlo? Ngayon po, noong 1905, naging Bureau of Health na po. Okay? And then, noong 1912, this is the Act number 2156, also known po as the Fajardo Act. Dito po nagbibigay sila ng travel fund. Okay? And also nagbibigay din ng salary for the health. Diba, meron tayong mga doctor to the barrio. Ayan, binibigyan po yan ng fund. May enough budget po para dyan. So, that is the Fajardo Act po. Okay? So, na-establish yan noong 1912. And then, noong 1915 naman po, Act number 2568. So, pinalitan po nila. Diba? Kanina, from Bureau of Health, ginawa naman pong Philippine Health Service. Okay? So, this is a semi-military system of public health administration. Okay? So, kanina, di ba, Bureau of Health, ginawa nga yung Philippine Health Service. Kailan po yan? Noong 1950. Next. Noong August 2, 1916 naman po, dito nagkaroon ng Act 2711 which included the Public Health Law of 1970. Nagkaroon po dito ng Public Health Law. And then noong 1932, nire-organize nila. Okay, nagkaroon ng Reorganization Act of 1930. Okay, next. Noong May 31, 1939 naman, okay, yung Commonwealth Act number 430 po, is create nila yung Department of Public Health and Welfare. Okay? So, dito po talagang ni-revise nila, pinaganda nila. Okay? And na-complete po ito through the Executive number 317 noong January 7, 1941. Okay? So, dito po nagkaroon ng pinakaunang secretary ang ating Department of Public Health and Welfare. So, ang secretary po niyan is si Dr. Jose Fabella. Okay? Dr. Jose Fabella. Next. No October 4, 1947. So, when we say EO, that is Executive Order number 94. Dito po nagkaroon ng post-war reorganization of Department of Health and Public Welfare. So, nag-reorganize na naman po noong 1947. Okay? Kung saan, na-split po yung public welfare. Ang naging pangalan niya na po is Social Welfare Administration. And then, na-split din po. So, naging Bureau of Hospital and Preventive Services o tinatawag na po siya ulit na Bureau of Health. Okay? Kasi nire-organize ulit nila. Okay? Kailan po yan? Noong 1947. Okay? Next. Then, noong January 1, 1951, dito naman po nagkaroon ng conversion of sanitary district to rural health unit. Okay? So, from district po, dinalada din nila itong mga services na to sa rural health unit. Ibig sabihin sa mga provinces, sa mga liblib na lugar, kung saan itong mga services na po ito, layunin na magkaroon ng maternal and child health. Okay? Maayos at maganda yung kalusugan ng buntis and also ng mga bata. Environmental health po. Makontrol yung mga communicable diseases. Vital statistic. Magkaroon po ng medical care, health education, and public health. Ito po yung services na yun. Okay? Next. Okay, so kaya continuation naisapasa na po, okay, or naibatas, okay, yung Rural Health Act of 1954. Okay, so that is the Republic Act 1082. Okay? And then noong 1970, na-conceptualize po nila, okay, ni-restruct nila yung healthcare delivery system. So dito po nagkaroon ng primary, secondary, and also tertiary. Okay? Tertiary level of care. Okay? So, dyan po yan. That was on 1970. Okay? So, yung hospital po, meron na yung category or merong level. So, meron tayo tinatawag na primary, okay, or level 1, secondary, level 2, and then tertiary level 3. Explain ko po yan later sa ating discussion. Okay? Next. Noong June 2, 1978 po, PD, when I say PD, that is Presidential Decree. Okay? Okay, yung PD 1937. So, di ba, DOH po siya. Ngayon, binalik na naman. Pinangalan na naman nilang Ministry of Health. So, that is during the martial law po. And ang kauna-unahang secretary po dito sa Ministry of Health is si Secretary Gatmaitan. Okay, Secretary Gatmaitan. Another one, pakitake down notes po na noong 1979, nagkaroon ng adoption of primary health care. Okay? Sulat ko sa ating sunshot ha. Ayun. Para tama po yung spelling na makuha nyo, punta po kayo sa ating sunshot. In 1979, so dito po nagkaroon ng adoption of primary healthcare. Okay? So, itong 1979 or adoption of primary healthcare po, dito po, they are promoted participatory management of the local healthcare system. Okay? So, dapat daw po nagkakaroon na ng management yung ating local healthcare system. Okay? Next. Noong December 2, 1982 naman po, nagkaroon naman dito ng EO or Executive Order 851 kung saan nire-organize po ng Ministry of Health as an integrated healthcare delivery system through the creation of integrated provincial health offices combining the public health and hospital operation under the Philippine Health Organization. So, meaning, noong 1982, nire-organize po nila. Okay? So, pinagsama na po yung public health at saka yung hospital services. Kailan po yan? December 2, 1982. Okay? And then, noong April 13, 1987, under Executive Order number 119, yung Ministry of Health po, binalik na naman nila. Okay? Pinangalan po nila as the Department of Health. And as of today po, Department of Health pa rin yung pangalan. Diba? Okay? So, under po yan ng administration ni President Cory Aquino. Okay? Another pa po, paki-take down notes. We also have here the 1988. Okay? So, this is the Generic Act. Generic Act. Okay, so 1988 po yan. This is the Generic Act kung saan yung prescription po, this is written na using the generic name of the drug. Okay, ibig sabihin yung mga doktor pag nag-prescribe sila, hindi na po brand name yung isusulat nila. Dapat yung generic name na nung mismong gamot. Okay, kailan po yan? Noong 1988. Okay, so this is also known as the Generic Act. Okay, please take down notes of the spelling po nandyan sa ating sunod. Next. October 10, 1991, okay, or the Republic Act 7160. This is also known po as the Local Government Code. Okay. So dito po, okay, tinransfer yung responsibility ng health services provision doon sa local government unit. Okay. So yung personnel at saka yung mga budget allocation po. Okay. So from health services provision, ang mag-mandate or mag-govern na po is the local government unit or the LGU na. Okay. So as you can see, diba, as of today po, ang mainly na may responsible pagdating sa health is yung bawat LGU na, diba? For example, yung vaccination ng COVID-19, diba? Papansinin nyo po, meron silang, sila yung nagmamandate or sila yung nagbibigay ng policy. Kailan pwedeng magpabakuna, diba? Kaya nga, di ba, ngayon yung mga vaccination card, iba-iba po bawat local government. Sa Pasig po, ang sabihin natin, example lang, color blue, yung, basta iba yung, kasi po, through the Act, or to the Republic Act 7160, binigyan po ng, or nagkaroon ng transfer of responsibility, yung health services, binigyan nila ng kapangyarihan yung ating local government na pangalagaan yung health ng kanilang mamamayan or ng kanilang community. Okay, so kailan po yan? That is October 10, 1991. Okay, so from provincial to local government na po. Tawag dyan, nagkaroon ng devolution or devolved health sector. Okay, another one is noong 1995. Okay, 1995. This is the National Health Act. Okay. So, aims po nito is to provide all citizens a mechanism for financial protection. Okay? So, layunin daw po nitong National Health Act na mapangalagaan lahat ng mamamayang Pilipino na magkaroon ng financial protection. And mas binibigyan po nila ng priority yung mga mahihirap. Okay? So, that is the National Health Act. And then, noong 1996, Health Sector Reform Agenda. Okay. Tingnan nyo po sa Zoom chat ha. Health Sector Reform Agenda. Dito po nagkaroon ng major organizational restructuring of the DOH. Okay. So, layunin po nito na ma-improve yung way of health. Okay. Also, mas ma-regulate and ma-finance ng tama. Okay. So, that is 1996 Health Sector Reform Agenda. Okay. Next. Noong May 24, 1999, okay, Dito po nagkaroon ng Executive Order 102 redirecting the function and operation of the DOH by President Joseph Estrada. Okay, nagkaroon ng redirecting. So, inayos po ulit nila. So, under po yan ang administrasyon ni President Joseph Estrada. And then, noong 1999 to 2004, yan po, dinevelop nila nga itong health sector reform agenda. Okay? And then, 2005 up to present po, nagkaroon ng development of plan to rationalize the bureaucracy. Okay? And then, noong 2005, okay, 2005, dito po meron tayong tinatawag na formula. Okay, formula or Formula 1 or F1 na tinatawag for health. Yan ha. Formula 1, F1 for health. Okay, dito po nagkaroon ng adoption of operational framework. Okay? Ulitin ko po ang Formula 1 for health, nagkaroon po dito ng adoption of operational framework. Ibig sabihin, inadapt po nila yung operational framework, okay, para magkaroon daw po ng magandang speed, precision, and effective coordination ng ating health. Ulitin ko ha. Ang Formula 1 po, nagkaroon dito ng adoption of operational framework. Okay, para magkaroon daw po ng magandang speed, precision, and effective coordination ng ating health. Okay? And then, noong 2008 naman po, nagkaroon ng RA 9502, okay, or access to cheaper and quality medicine. Okay, 2008, RA 9502, Access to Cheaper and Quality Medicine Act. Okay, so dito naman po, layunin nito, okay, or this promote to ensure na lahat po is magkakaroon ng access sa affordable quality drug. Okay? Ibig sabihin lahat po makaka-access. Okay? Sabihin lahat kayang maka-afford ng mura at quality na gamot. Okay? So that is Access to Cheaper and Quality Medicine Act. And then, noong 2010, okay, this is AO, okay, Administrative Order 2010, series of 36. Ito po ay tinatawag na kalusugang pangkalahatan. Okay, please take down notes of the spelling po nasa ating Zoom chat. Okay, so this one naman po is the universal health, okay, health coverage and access to quality healthcare for all Filipinos. Sabihin po, layunin nito na lahat ng tao po or lahat ng Pilipino is makaka-access sa maganda. Okay? Maganda or magandang health services. Okay? So, ibig sabihin, quality healthcare for all Filipinos. Okay? That is 2010 po. Okay? Next. So, today po, we have the directions of the Philippine health sector. Okay? So, ito po yung kanilang direction. Philippine Health Agenda, okay, Philippine Development Plan, Development Plan 2017 to 2022. NEDA, ang vision natin, 2040. Ito po yung diniscuss ko sa inyo, di ba, SDG Goal 2030. Okay, so ito po yung for the future ng health. Okay, na as of now, nakafocus ang ating DO. Okay, next. Ito naman po yung vision and mission ng ating Department of Health. Okay, sabi nila, ang kalusugan daw is karapatan. Okay? Parang sin sa alma ata. Okay? And also, ang kalusugan daw is para daw po sa lahat ng Pilipino. Okay? And ang mission po ng ating DOH in partnership with the people to ensure equity, quality, and access to healthcare. Dapat daw by making service available, by arousing community awareness, by mobilizing resources, and also by promoting the means to better health. So, yan po yung mission ng ating Department of Health. Okay? Another one, let's move na po to the primary healthcare. Sabi po, ang primary healthcare daw po, this is at its heart. Primary healthcare is about caring for people. Sabihin, nag-care ka po doon sa mismong pasyente mo. Okay? Rather than simply treating the specific disease or condition. Okay? So, of course po, hindi mo lang simple tinitreat yung sakit ng pasyente mo. But of course, nagkakaroon ka rin daw po dapat ng care sa iyong patient. So that is primary healthcare. And ang primary healthcare po, this is usually the first point of contact people have with the healthcare system. So dapat daw nagpo-provide tayo ng comprehensive, accessible, and community-based care. Okay? And also, ang ang primary healthcare po, this is according to the Alma Ata Declaration. So, intended po nito na kailangan ma-reach po lahat ng tao. Okay? Lalong-lalo na daw po yung may greatest need nito. Okay? So, that is the primary healthcare. Sorry. Primary healthcare po yan, ha? Next. Ang goals po ng primary healthcare is, of course, magkaroon po ng universal coverage. Maganda yung maging service delivery. Of course, yung community po magkaroon ng participation, maayos at magandang leadership, and magkaroon po ng magandang public policy. Okay? We also have here po the essential elements ng primary healthcare delivery system. First po is magkaroon daw ng adequate and safe water supply and also basic sanitation. Sabihin, magkaroon po ng malinis na tubig as well as magandang sanitation. Magkaroon po ng bakuna, lalong-lalo dun sa mga major infectious diseases. Okay? Local endemic disease control. Okay? Appropriate treatment of common diseases and injury. Okay? Magkaroon po ng basic medication. Ma-expand yung option of immunization. Reproductive health needs, provision of essential technology for health promotion, prevention and control of non-communicable diseases, and food safety and provision of selected food supplements. Okay? So lahat po ito is the essential element ng primary health care. Okay? Next. We also have here po the core principles of primary health care by WHO. Sabihin po, dapat daw lahat magkaroon ng universal access to care. Sabihin, lahat naka-access po pagdating sa kalusugan. Pangalawa, magkaroon po ng health equity. Okay? Pangatlo, magkaroon ng community participation. Okay? Then pang-apat po, magkaroon ng intersectoral approaches to health. Okay? So this is the core principle po ng primary health care. So that is from WHO. Next, we also have here po the management of primary health care naman. Okay? Ang management po ng ating primary health care as healthcare manager, they are usually carrying out the following function in the process of management. Okay? So, first here, meron po tayong 5 para ma-manage natin ng maayos ang primary healthcare. Number 1 here is the planning. Pag sinabi po natin planning, it means setting priorities and determining performance targets. Again, uulitin ko po when we say planning, it means setting priorities and determining performance target. So, di ba? Pag planning, nagpaplano ka. So, dito po, nagsiset ka na ng priorities. Ano yung need mo dapat ma-target? Okay, that is planning. And usually po, okay, manager po yung dapat na gumagawa nito. Okay? So, they are required to set the direction and para ma-determine po ano yung dapat ma-accomplish. Okay, that is planning. Pangalawa, we also have here po the organizing. Okay? Ang organizing naman po, this is determining position. Okay? Teamwork assignment, as well as dito po nagkakaroon ng distribution of authority and responsibility. That is organizing. So, from the word itself po, di ba, nag-organize. Okay? Ayan. Next, number 3, staffing. Okay? Ang staffing naman po, dito nagkakaroon ka ng, or nagde-develop ka, as well as mini-maintain mo po yung workforce mo. Okay? Through various strategies and tactics. Ulitin ko po, when we say staffing, okay, dito po nagde-develop ka, nagme-maintain ng workforce mo through various strategies and tactics. Okay? So, that is staffing po. Okay? So, of course, dito nag-a-acquire ka and nagre-retain ka ng human resources. Yung mga staff mo. Okay? Next. Number 4 is controlling. Pag sinabi naman po natin controlling, okay, this means minomonitor mo po yung activity ng iyong mga staff. And also yung mga performance nila, okay, minomonitor mo po yan. That is controlling. Okay? And of course, pag may nagawa silang hindi maayos or hindi maganda, of course, gagawan mo po yan ng corrective action as the manager. So that is controlling. And number 5, we also have here the directing. Pag sinabi naman po natin directing, so this is focus in to initiate action in the organization. Okay? So dito po nagkakaroon ka ng nag-i-initiate ka na ng action doon sa organization mo. Okay? Through what? Of course, through effective leadership and motivation. Okay? So ibig sabihin, dapat maganda po yung communication mo doon sa iyong mga staff. So pag alam mo parang hindi na maayos ang ginagawa nila, dapat meron kang magandang communication sa kanila. Okay? So that is directing. Nire-redirect mo po sila. Okay? Para mas mapaayos at mas mapaganda pa as a manager. Okay? So this is the management of primary healthcare po. Next, we also have here po the Philippine Healthcare Delivery System through the Department of Health. Okay? Ang primary function po nito, first is magkaroon ng promotion, protection, preservation, or restoration of the health. Okay? Through the provision and delivery of health services and through encouragement of provider of health, goods, and services. Okay? So, ito po yung primary function. Another one here is we also have here po 3 levels of primary healthcare worker. Okay, meron po tayong 3 level ng primary healthcare worker. First po is we have here the village or grassroots health worker. Okay, so they are the first contact, okay, socio-economic, curative, and preventive. So ang village or grassroots health worker po natin, okay, ito po yung sa ating mga barangay. Okay, so sila po yan, yung ating community health worker, mga volunteer sa barangay natin, traditional birth attendants. So ang tawag po sa kanila is village or grassroots health worker. Another one is we also have here the intermediate level health worker. Ito naman po yung first source, provide support, and then attend to health problems. So di ba pag sa barangay, halimbawa, pumunta ka po, hindi lang naman health worker yung makikita mo, hindi lang din po volunteer. May makikita ka rin po dyan mga doctor, nurses, and midwife. So, ang tawag po sa kanila is intermediate level healthcare. Okay? And then, pangatlo, we also have here the first line hospital personnel. Ito naman po yung nag-i-establish ng close contact sa pasyente and backup health services. When you say backup health services, for example po yung barangay, hindi na kaya yung pasyente, for example, yung pasyente ng anak, then hindi siya makaanak-anak, kailangan pala i-CS na siya, okay? So, of course, dadalhin po yan sa pinakamalapit na hospital. And ang makikita niyo po doon, they are the first line hospital personnel. Okay? So, they are backup health services. So, makikita niyo po dito is yung mga physician or yung mga doctor na may specialty, nurses as well, dentists, pharmacists, and other health professional na po. So, ang tawag sa kanila is first line hospital. Okay? Next. Now po, let's move naman to the building blocks of health system. Diniscuss ko na po ito sa ating health system. Pero ngayon po, i-discuss natin further and mas deeper. Okay? Unahin po natin pag-usapan yung leadership and governance, okay? Dito sa Pilipinas. Okay? Itong building blocks of health system, pag-usapan po natin yung leadership and governance dito sa Pilipinas. Okay? So, devolution. Okay? So, ito yung binanggit ko kanina, di ba? Devolution po, this is referred to the act by which the national government confirms power and authority upon the various LGU to perform specific function and responsibility. Dito po, ang ating local government unit is binibigyan ng increased power. Okay? Binibigyan sila ng kapangyarihan na mag-mobilize po yung resources pagdating sa health. Okay? So, this is under RA 7160. Nagkaroon po na ito, ayan nga, legal base of devolution and devolve the following basic services. Okay, interlocal health zone, inspired po ito by the district health system of World Health Organization, as well as composed po ito ng cluster ng municipalities, okay, usually po na may similar health needs plus other stakeholders. Okay? Uulitin ko po, ang RA 7160, devolution, okay, or dito sa leadership and governance, binigyan po ng kapangyarihan yung ating mga local government, okay, na ma-mobilize nila yung resources pagdating sa interlocal health zone. Okay? Sabihin, naka-integrated po yung health management and delivery system, okay, based doon sa defined administrative. Okay? So, kaya nga ngayon, iba kung papansinin nyo po, pagdating sa COVID-19, iba-iba yung restriction na binibigay ng bawat LGU. So, ganito yung binibigay sa Pasig, ganito naman yung binibigay na restriction pagdating sa Mandaluyong. So, magkakaiba po. Kasi nga, this is through the RA 72160. Binigyan po yung LGU ng kapangyarihan na ma-mobilize yung resources pagdating sa health. Okay, so ayan po. Next. Next naman po, pag-usapan natin yung service delivery. Okay? Health service delivery, yung key elements po, this is more on organizing health services as network of primary care, backed by hospital and specialized. Okay? Providing package of health benefits with clinical and public health intervention. Okay? Dito po ini-ensure yung access and quality of services, and holding providers accountable for access and quality and ensuring consumer voice. Okay? So this is the key elements po ng health service delivery. Okay? So, meron po tayong forms ng health service delivery sa Pilipinas. Okay? Meron tayong forms ng health service delivery sa Pilipinas. So, public sector that is created by law. Okay? So, ang national, okay, DOH po. Okay? That is the Department of Health. Pagdating sa health services. Okay? Sa Pilipinas, ha? So, of course, ang nagmamandate ng national, lahat-lahat sa Pilipinas is the DOH. Okay. Pag local naman po, of course, the LGU. Kaya, di ba, sabi ko sa inyo, may mga restriction. Dahil po to sa batas na RA. Yung kanina yung binanggit ko po, yung binibigyan ng kapangyarihan yung LGU. Okay? Pagdating sa pag-mandate ng health nila, ng kanilang community. Okay? So, ayan po. Health services delivery in the Philippines. And also, ang government health facility po, this may be under the national government, tulad ng DOH, LGU, Department of National Defense, PNP, DOJ. Okay, so ayan po. Also, this is also financed through taxes. Okay, so, of course, para makapagbigay ng mga magandang serbisyo, kailangan ng budget. So, yung budget na po yan, nanggagaling po yan sa tax ng bawat Pilipino. Okay, kaya nga dapat ang healthcare services, this is free at the point of care. Okay, next. Public health, ayan, LGU, direct delivery of public health services. Okay. And we also have here the OH. Okay. They give technical assistance po pagdating sa capacity building, advisory services for disease prevention and control. So sila po yung nagbibigay ng advisory. Okay. Di ba, for example, nung COVID-19, nung kasagsagan ng COVID-19, okay, di ba ang DOH lagi pong ina-update yung buong bansa regarding sa ilan na ba nagkakaroon ng COVID, ano yung dapat gawing restriction. Kasi that is the main responsibility po ng ating DOH. Okay? As well as dapat they provide free medicine and vaccine. Kaya nga po, di ba, ngayon libre yung bakuna for the COVID-19. Okay? That is DOH pa din po. Responsibility pa rin po nila. Okay? So, ayan. Next, we also have here po the forms of health service delivery in the Philippines. Okay? Same pa din po. So, kanina government, di ba? Ngayon naman po private sector. Pag private sector po, pwede po itong may nagmamay-ari o ng isang individual lang. Pwede rin po siyang established and operated with funds through donation. Okay? Pwede rin investment or corporation siya. Okay? So, ayan po. So, that is private sector. Okay? So, ano yung mga private sector? Pwedeng may clinic, hospital, health insurance, manufacturing of medicine and vaccine. Okay? Medical supply, equipment. So, pwede pong nagmamay-ari niyan is private sector. Okay? Another one here is we also have here for the classification of health facility. Meron po tayong classification ng health facility dito sa Pilipinas. Number 1 is according to ownership. Pangalawa po is according to scope of services. And then pangatlo is according to functional capacity. first po nating pag-usapan is yung according to ownership. Okay? When you say according to ownership, ibig sabihin yung nagmamay-ari po ng health facility na yon or ng hospital na yon. So, pwede pong government, okay? Pwede rin private ang nagmamay-ari. Okay? When you say government, ang may-ari po ng hospital na yon or institution na yun is our government. For example po is the Philippine General Hospital. So, of course, that is owned by the government. Kaya nga po kapag nagpa-check up ka doon, nag-avail ka ng services, mostly po doon libre. Okay? Kasi government po. Okay? Ang babayaran mo na lang doon is yung mga gamot. Ayun. Pero most of the time, libre po. And also, mas mababa yung service na binabayaran mo. Okay? That is government po. Okay? Government ang nagmamayari. Another one here is private. Pag private naman po, of course, di ba sabi nga natin, pag private sector, this is own, finance, either corporation. Ayan. So, ibig sabihin, private po sila. Okay. Example po na ating private hospital or private institution is Makati Medical Center. Okay. St. Luke's Medical Center. So, that is a private hospital. Okay. Of course, pag private, medyo price. Okay. May pricey talaga. Kasi private hospital yan. Lahat po dyan babayaran. Okay. Next. Classification naman po according to scope of services. Okay? So, ibig sabihin, yung scope of services na na-offer ng hospital na yon. First is, we have here po the general hospital. When I say general hospital, lahat po na services kaya nilang ma-offer. Okay? Example po na ating hospital dito sa Pilipinas is the Philippine General Hospital. Lahat po tinatanggap nila dyan, lahat ng pasyente. Okay? Another one is Jose Reyes Memorial Medical Center. So, general hospital po sila. Okay? Another one, we also have here for the specialty hospital. Pag sinabi naman natin specialty hospital, ito naman po yung hospital na merong specialization. Okay? For example po is the Philippine Heart Center. Of course po, ang mainly na ina-accept nila ditong mga pasyente is yung meron pong problema pagdating sa heart. Okay? So, yun yung pinaka-specialty kasi nila. Okay? Another one example is the NKTI po. Or the National Kidney and Transplant Institute. So, mainly po na ina-access nila dito is may problema pagdating sa kidney. Okay? Kasi they are ayun po yung specialization nila. They are a specialty hospital. Okay? Another example po is the Lung Center of the Philippines. Of course, ang meaning pasyente po, mostly yung pasyente makikita mo na nasa lung center of the hospital. Kasi yung mga pasyente may problema sa lungs. Okay? So, ayan po. Pag general hospital, general lang po lahat. Example naman ng general hospital is the East Avenue Medical Center. Okay? That is a general hospital. Okay? So, ayan ha. This is a classification naman according to the scope of services. Another one here is we also have here po the classification according to functional capacity. Okay? So, sa general hospital po, meron tayong tinatawag na level 1, level 2, and also level 3. Okay? Pag sinabi natin level 1, i-discuss natin one by one. Discuss ko po ito later din, yung other health facility. Ito muna tayo sa level 1. Pag sinabi po natin level 1, okay, this is clinical services and facility for inpatient. Ito po yung na-offer nilang services sa kanilang mga pasyente. Okay, meron silang medicine, pediatric, OB, and surgery. They also have here po the emergency and outpatient, isolation, surgical, maternity facility, and dental clinic. Okay? Ang ancillary service naman po na na-offer nila dito is the secondary, blood station, first level X-ray, and pharmacy. Okay? Pag level 2 naman po, okay, ang services na na-offer po nila is lahat na ng level 1. As well as meron na din po silang departmentalized clinical services, meron din silang respiratory unit, general ICU. Kanina di ba sa level 1 wala. Sa level 2 po, meron na tayong intensive care unit. Okay? Kaya na rin po nilang i-cater yung mga high-risk pregnancy. And meron din po silang neonatal ICU or neonatal intensive care unit. Okay? Ang ancillary service po nila na-offer, kaya po nila mag-cater ng tertiary clinical laboratory, blood station, and second level X-ray. Level 3 naman po, lahat na ng level 1 and level 2, meron sa level 3. Lahat po ng services. And ang level 3 lang po natin, ang only capable na mag-accept ng internship or ng nag-o-OJT. Okay? So, hindi po capable ang level 1 at level 2 na mag-accept ng interns or ng yung nag-o-OJT ng mga nurse natin, doctor, medical technologists, and other medical professionals. Only level 3 lang po ang may capability mag-accept ng interns. Okay? Bakit? Kasi kompleto po yung services na na-offer sa level 3 or sa ating tertiary healthcare facility. Okay? Ancillary services po nila is tertiary clinical laboratory, blood bank, and third level X-ray. Okay? So, ayan ha, ayan po yung difference. You have level 1, level 2, and level 3. When you say level 1, that is the primary. Level 2 po, that is the secondary. And then, level 3, this is the tertiary healthcare facility. Okay? So, example po ng level 3 or tertiary healthcare facility is pag private, Makati Medical Center, St. Luke's Medical Center. Ayan po lahat kaya nilang ibigay o yung servisyo, they are complete. Pagka-public naman, Philippine General Hospital, that is tertiary po. It's Avenue Medical Center, that is also tertiary or level 3 na po. Kaya nga, di ba, nagpapadala tayo doon ng interns. Yan ha, ganyan po yung level of care. Okay? Next, we also have here po the level of healthcare and referral system. So, for example po, may nasugatan or yun nga, of course, di ba, una pong dinadala sa barangay health station or sa barangay health center. Pag hindi po kaya ni barangay, move forward po yan sa rural health. Pag hindi kaya ni rural health, dadalhin sa district hospital. Pag hindi pa rin po kaya, provincial hospital, regional, and then dito na sa tertiary. Okay? Kaya nga po minsan, di ba, may mga nagrereklamo. Yung hospital na to, kulang-kulang naman. Pinalilipat kami dito sa kabilang hospital. Tapos ngayon, pinalipat ulit kami sa kabilang hospital. Okay? Kasi po, baka hindi nila alam na yung napuntahan nilang hospital is only primary level or level 1 lang po. Of course, pag level 1 lang po, limited lang yung capability or yung service po na na-offer niya. Okay? So, kung gusto nyo po talagang complete services, pumunta na po agad kayo sa tertiary hospital or doon sa level 3 hospital. Ibig sabihin, kompleto na po yung services na may bibigay niyan sa inyo. Okay? Kaya, ayun. Kaya kasi madami nagreklamo, kulang-kulang pang hospital na to. Kasi baka hindi nila alam, baka level 1 pa lang yung accreditation ng hospital. So, we have level 1, we have level 2, and we also have level 3 po. Okay? So, ayan siya. Next. We also have here po the other health facility. Okay? Meron tayo ditong primary care facility. Okay? With inpatient bed, infirmary, or birthing home. Ayan. So, ito po, when you say primary care facility, ito lang yung focus nila. Birthing home, mga lying-in clinic natin. Ayan po. Without bed, ito po yung mga outpatient. So, clinic lang na nag-offer it ng 8 to 5. Ayan po. Primary lang, care facility sila. FW clinic and mga dental clinic natin. So, most na kinikater po dito is the outpatient. Hindi po na-admit. Okay? Another one, we also have here the custodial care facility. Dito naman po, more on silang nag-care sa mga pasyente. Have here the psychiatric care, drug abuse, sanitarium, and nursing home. Meron din tayong diagnostic. So, mean po ito for diagnostic. Example natin yung mga laboratories. Yan. Drug test, newborn screening, water laboratory, nuclear med, ano po. And we also have here the specialized outpatient facility. Okay? So, example nito is dialysis clinic, ambulatory surgical clinic, oncology, radiation. Okay? So, now, let's move on na po. Another building blocks naman of health system dito sa Pilipinas is the human resources. So, ang human resources po, of course, kailangan makapag-achieve, di ba? Sabi nga natin, dapat merong maayos at magandang mixture ng staff. Okay? Dapat ini-ensure po na maayos at maganda yung mixture ng staff. At the same time, dapat maayos din yung working environment and dapat po nabibigyan sila ng right incentive or right payment system. Okay? Next, let's move on naman po dito sa ating medicine and technologies. Sa medicine and technologies po, we have here the pharmaceutical care. Okay? So, sa pharmaceutical care, of course, ang nagdi-distribute po sa yung driven distribution scheme natin, saan ba tayo nakaka-access ng gamot? Of course, sa mga drugstore as well as sa hospital. Okay? Meron din po tayong tinatawag na monopolistic pricing. Okay? When we say monopolistic pricing po, dinidiscourage po ng private hospital na bumili yung pasyente ng gamot sa labas. Okay? Bakit? Kasi minsan yung private hospital na yun, nagbibigay po sila or mas mahal yung gamot or double the price yung gamot na binibenta nila. Okay? So, ayan. Kaya pinagbabawalan nilang bumili. Kasi yung ibang pasyente bumibili sa labas kasi nga mas mura talaga. Okay? So, ayan po. Next. We also have here the constraint in accessing essential drugs, the limited availability, irrational use, and high cost. Now po, let's proceed naman sa ating medical technology and devices. Okay? This is the Bureau of Health, Devices, and Technology of the DOH. Okay. Ito po ay nagde-develop ng plan, policy, program, and strategy para ma-regulate yung health and health-related devices and technology. Okay? Another is move po tayo dito sa health financing. Okay? Pagdating po sa key elements in health financing, meron tayong tinatawag na raising. So dito po nagre-raise dapat ng sufficient funds pagdating sa health. Pooling naman po, this is pooling financial resources across population group and sharing financial risk. Okay? Share sila dito ng financial risk. And then utilization, kailangan po yung funds na nakuha dito sa health budget is ma-distribute po efficiently and equitably. Okay? And also, meron tayong tatlong major group ng payer pagdating sa Pilipinas. Okay? We have here the government, social health insurance, and private sector. Ayan. Ito po siya. So, dito po, of course, pag government, okay, of course, yung binabayad po ng government, is nanggagaling pa rin po yung budget nila, nanggagaling sa general tax, sa atin pa rin, sa tax ng tao, or sa tax ng Philippines. Okay, so ayan siya. And we also have here the Republic Act 7875, which is the National Health Insurance Act. So inaalaw po nila na yung bawat Pilipino magkaroon ng health insurance. So ang cover po nito ay yung mga employed sector program, pwede ring individually paying program, sponsored program, OFW, or lifetime membership program. So that is RA 7875. Inaalaw po natin government na magkaroon ng health insurance ng isang Pilipino. Okay? Now, let's move on naman dito sa last health building blocks, which is the health information. So, ang key elements po pagdating sa health information is provide timely and quality evidence to inform policy development and planning, health advocacy, and education. Sabihin, magkaroon daw po ng feedback pagdating sa health information. Magkaroon po ng maayos at magandang access lahat ng Pilipino, and ma-maximize po yung paggamit ng information technology para mas mapabetter pa po or mas mapaayos yung ating health services. Okay? Kasi lang po, as of now, pagdating sa health information dito sa Pilipinas, okay, poorly integrated daw and weakly governed. Sabihin, hindi gano'n ka napipigyan ng attention. Okay? Also, yung ating mga telecom infrastructure, mas nakafocus po kasi sila sa cities kumpara doon sa ating rural or doon sa mga probinsya. Okay? Unclear consideration po pagdating sa IT, hindi nila alam po ano ba yung kanilang role. Okay? And also, kulang po ng information technology. Ayan siya. Okay? Kaya nga po nagkaroon tayo ng National Telehealth Service Program. So, ang aim po nito is to improve communication capability, as well as magkaroon po ng better access pagdating sa information, and magkaroon po ng consultation with clinical specialists and other form of support for health professional in remote communities. Okay? So, di ba ngayon, nung nagka-COVID-19, kung papansin niyo, nauso po yung teleconsultation. Okay? Which is hindi mo na po kailangan pumunta doon sa hospital or makaharap ng face-to-face ng doctor. Pwede mo na lang po siyang tawagan. Okay? So, pwede kang sa kanya magpa-consult, okay? Regarding sa nararamdaman mo. Okay? Or sa sign and symptoms ng nararamdaman mong sakit. Okay? So, ayan po. We have here po 3. We have here the e-medicine, okay? Or the teleferas. Okay? Ang e-medicine po, this is an electronic or digital record kung saan nakastore po dito lahat ng medical information ng pasyente. Okay. Another one, we also have here the e-record. Okay, when I say e-record, this is electronic record. kung saan yung information po ng pasyente nakastore online. Okay? This is computerized retrieval of patient record. Pwede rin po ma-retrieve yung record ng pasyente dito. And another one, we also have here the e-surveillance. Ang e-surveillance naman po, this one is an electronic monitoring of health indicator and performance. So, namo-monitor po dito, okay, ang mga health indicator. For example, ngayon, di ba, nagkakaroon ng COVID-19. So, dito po namo-monitor nila kung tumataas ba yung COVID-19, bumababa ba, ilan yung nagkakasakit. So, ang e-surveillance po, this is for epidemiology use. Okay? Sa e-medicine po, meron tayong tinatawag din na RX box. So, ang laman po ng RX box na yan, we have there the ECG, the blood pressure apparatus, pulse oximeter, tachometer, and fetal heart rate. Okay? So, this is an example po of RX box. Okay? Sabi nga natin, di ba, may pulse rate, okay, may BP, blood pressure,